Okay, so now we're gonna look at impetigo. And impetigo की मैंने दो ऊपर बताई थी कि क्या क्या चीज़ें हैं. So we saw that um, when we would describe it, right? For example, we're describing this picture. We'd say that the patient appears to be a young infant with lesions present on the cheeks and on the chin. These lesions appear to be erythematous with a tinge of mustard, honey-colored lesions as well. These appear to either be sort of like, I would say, like, because they kind of look like pustules, that's how you would describe it in the picture. But otherwise, it is a raised lesion, and it is clearly more than 1 centimeter, so we would call it a plaque, right? So we'd say, okay, these are plaques on the face with areas of, so you see that these are some areas that are less than 1 centimeter. So we'd say that it is small papules, right? So we'd say papules and plaques, right? But we wouldn't mention nodules because, of course, it isn't like extremely raised. And then we'll say that the surrounding skin appears to be normal and the lesion is well demarcated. And so then this would be non-bullous because we don't have bulla. Now हमने बोला क्या कहा था कि these are fluid-filled raised lesions, and these are more than 1 centimeter, so these are bulla. And the bulla would be, we'd say that the surrounding skin is erythematous. I think this is like the lower abdomen and then the upper leg, and there are multiple lesions which are yellow in color, which leads me to believe that these are either pus filled, if we don't know what it is, but because we do know that it's bulla, so we'd say that these are bullas more than 1 centimeter, well demarcated. And we also see यहाँ पे crusting, right? And so we don't really see crusting in this picture, but we do see crusting in this picture. And then we'll say that the skin is erythematous, right? So the important things to know are the causative organisms. So in impetigo, there are two organisms, which is staph, and then strep pyogenes. Like I said, there's patches, right? So there could be flat areas and then blacks, and it's honey crusted, and then it's bulla, which is fluid filled. And then the next thing is that to avoid contact, okay? This is the non-pharmacological management, is to avoid contact with other things, isolate this child, because if you don't, then this is contagious. Hand washing, hygiene, no towel sharing, don't go to school, and trim your nails so that they don't end up scratching and then worsening their own condition. And for this, we'll give augmentin या penicillin, because we give augmentin in Staph aureus की जो भी infection होती है, and then fusidic acid also for Staph aureus की जो भी infection होती है, which is local topical antibiotic, right? Okay, so then moving forward to the next lesion. So the way we would describe this is this is ulcerated, right? And we know that this is ulcerated just because we know it's erythema. But also from the picture, we can see that the epidermis is sort of lost, and we can see the dermal layer. So we'll say that this is ulcerated. It's erythematous because the surrounding wool is red. The borders are irregular, so it's like it's not circular, it's very like zigzag. And then it's surrounded by this whitish ring. And so this is usually, we need to understand that what is the pathophysiology. So erythema is an ulcer that occurs due to severe malnutrition or poverty, and the causative organism, like impetigo, is strep pyogenes. So we're going to say that strep pyogenes is the causative organism. So we're going to do an augmentin course for 2 weeks, and we are we're going to correct the underlying cause, which is of course malnutrition, which is of course malnutrition. So for that, we'll give green leafy vegetables, dal and gosh that they're affording, and most of the time this malnutrition is due to worms. So we're going to ask the patient to deworm themselves, and we're going to ask the patient to take care of their hygiene. And then we're just going to say don't shower in rainwater or in ye jo nale hote hain, because oftentimes this is where they get that infection from. Okay, so then the next thing we're going to do is like describe this lesion. So this is just so we can see, if we just like look at it, this is sort of this is well demarcated because we see like all of the borders, and this is an erythematous lesion. and it's clearly more than 1 centimeter, so it's a black, and it's palpable, right? And it's more than 1 centimeters, and it's erythematous, it's red, it's shiny, and the side is the leg, and so the